Good morning, everyone. If you're on the West Coast, good afternoon. If you're on the East Coast, I'm Lisa Ling, executive producer and host of This Is Life right here on CNN. I've been so proud to be part of a show that really tries to allow us to understand our fellow humans a little better, especially in these times of partisanship and division. I've covered some of the most defining moments in the lives of so many Americans over the last 7 seasons, even people who are very different from me and espouse different values. And now we are all experiencing what will surely be one of the most significant periods in our lives, the COVID-19 global pandemic. Now, as a mother, as a daughter, as a wife, I have to be honest with you, I'm really scared. I don't remember ever feeling this level of unease in my life. And I wake up every morning just wondering, is this real? I'm thinking how many people are going to die today? And I can't stop thinking about the valiant healthcare workers who are risking their lives every day to battle this virus. And so many of them are grossly underprepared. These are unprecedented times that will be recorded in our history books forever. And to make matters worse, because the virus reputedly started in China, people who look like me are being targeted. Now, I'm lucky. I've only been verbally assaulted online, but I've known so many Asians and Asian Americans, including young children, who have been taunted and even physically attacked. Joining me to talk about this is former presidential candidate Andrew Yang. He's a businessman, a father, and now a CNN contributor. And later, Andrew and I will be taking questions about what you can do in the face of hate in this critical time. Hi, Andrew. Thanks for being here. First of all, where are you?
Hey, Lisa. It's good to see you. I am in upstate New York, about 75 miles north of the city. My family and I came here, I want to say 2.5 weeks ago or so. So we've been out of New York City during the worst of the crisis.
So, Andrew, as you know, the FBI has been warning of a potential surge in hate crimes against Asian Americans, but that is already happening, and you know this. Can you talk about what you've learned?
I was on a call with the CEO of the crisis text line a number of days ago, and she said that the proportion of callers or users of the crisis text line who were Asian American shot up from 5% prior to the crisis, which is about in line with our percentage of the population. So that's pretty normal, up to 13%, 160% increase, and obviously way, way in excess of how many we are in the country. And I was staggered by this statistic because I knew what that meant in real life. Like, I know what that means is that hundreds of thousands of Asian Americans feel more depressed and even contemplating self-harm than had ever been the case before. Because for everyone who uses the crisis text line, there are probably many others who are not actually reaching out in any way. And so I heard this staggering statistic, and I've seen the same reports. I've gotten the same messages you have, Lisa, about friends and Asian Americans who are being either spat on or attacked or assaulted around the country. And it's just a heartbreaking phenomenon where, just like you, I mean, we're reacting this like the same way any other American does, which is with anxiety about the future and concern about what's going to happen with our families, our neighbors. But then it's compounded by the fact that, there's this massive increase in hostility and animosity towards Chinese Americans, Asian Americans, because so many Americans associate this virus with China.
Yeah, Andrew, I mean, I sent a couple of text messages or a couple of messages that I've received over social media that have just been just ugly and vicious and threatening. And, I'm sort of used to receiving all kinds of responses to things that I say because I've been doing this for a long time. But for people who have never experienced before, it's absolutely terrifying. And as I said, I'm lucky that I was only assaulted online. So many people have been victimized. And look, this is not something that Andrew or I want to be talking about right now. We're all just We are all so stressed out. This is such an unprecedented thing that is happening, but we would be remiss if we didn't try and take the time to talk about it because, according to Representative Judy Chu here in California, about 100 assaults on Asians are being reported every day. Andrew, I think you would probably agree that China should bear some responsibility for trying to cover up the crisis. And there are suspicions that they have intentionally misreported the death toll there. And it still breaks my heart to think about that Wuhan physician who was jailed when he tried to sound the alarm about what he believed was a new and deadly virus. So how should we be thinking about China right now?
I think it's important to distinguish between the Chinese government and the Chinese people. But certainly the Chinese government bears a lot of responsibility for the fact that it covered up the seriousness of the crisis early on. It was not sharing data with the rest of the world that could have helped not just us, but other countries prepare for this pandemic. And the seeds of this crisis certainly um, can be laid at the feet of the Chinese government. But then there's the Chinese people who suffered some of the same things that we're suffering. And then there are obviously Asian Americans who are this whole other set of people where
Who aren't even
we were
Chinese.
a world away while some of these decisions were being made by Chinese government officials. So the Chinese government certainly deserves some culpability. And if you're a human being who's trapped in your home right now, it's not, uh, it wouldn't be strange at all to feel a degree of hostility and anger towards Chinese government officials who might have made this crisis worse in its early days. So I understand that impulse very much.
Yeah, I mean, it's so important that people make the distinction between the Chinese government and Chinese people and Asian Americans. Now, as we all know, the coronavirus would eventually become known as COVID-19. That is how everyone the world over has been referring to it. Now, months into the crisis, President Trump insisted on referring to it as the China virus. So many have said that the virus started there, so why shouldn't it be called the China virus? Andrew, what do you think about that?
I don't see any positive value to calling it the China virus, except to incite hostility. I mean, it has a scientific name. And it's not like if you call it the coronavirus or COVID-19, that that somehow uh, obscures the fact that it originated in China. You know what I mean? Like that. Like there are a lot of things where they have a name that doesn't include the geographical origin, and in this case, including it just seems to me to be a way to incite hostility towards certainly the Chinese government, but also, unfortunately, Chinese people, and in this case, that extends to Chinese Americans and Asian Americans.
I think that if it had been called the Chinese virus from the beginning, it might be one thing, but months into the crisis, to start calling it the China virus, I can't see how that wouldn't incite people. I do have to point out that President Trump did tweet about this characterization. He said it's very important that we totally protect our Asian American community in the United States and all around the world. They are amazing people, and the spreading of the virus is not their fault in any way, shape, or form. They will be working closely with us to get rid of it. We will prevail together. I appreciate that tweet from him, but Andrew, do you think the damage has already been done?
Yeah, Chinese virus is definitely part of the lexicon at this point. And, I've heard of school children getting called the Chinese virus and being bullied mercilessly. And it's not like when Trump tweets something of a retraction several days later, all of a sudden, like it changes that behavior. So um, to me, it's good that he did that because at least it's an acknowledgement that calling it the Chinese virus has real impacts and consequences. But I don't think it somehow undoes the characterization or the impact it's having on um, hundreds of thousands of people around the country.
So I have a couple questions from people who are tuning in. The first one, Laura asks, how can the non-Asian community support people of Asian descent at this time? What should we do if we witness racial taunting or violence? Andrew, what do you think about that?
Well, certainly, uh, if you see something, you should definitely, like call it out and say, like, hey, like that's not correct. It's not acceptable. This person has nothing to do with the virus, or the impact in our communities. Uh, to me, like if we can use this crisis as a time to come together and say we're all American, that would be a huge opportunity, like a huge victory, even. And so, if there are people who are watching this who are not Asian American, and you just want to express some degree of empathy or understanding or solidarity, like I'm sure we'd appreciate it. I know I'd appreciate it. And so, if you see something, if you can make that situation better and less destructive, please, like we'd be incredibly grateful.
My husband and I have been emphatic about teaching our own kids to stand up for other kids if they see kids being taunted or made fun of or bullying. The sad reality is that bullying has in some ways been licensed because it's happening from the top down in our government. But it's something that if I were to suggest something to Laura, who's asking about what non-Asians can do, I would say, please stick up for us, because
Yeah.
that it's not the fault of ordinary citizens that this disease happened. We have nothing to do with the Chinese government, and there will be time for a reckoning when all of this is over.
Yeah, I would
Um,
say that the best thing anyone can do really is to uh, abide by the guidance we're getting from public health officials, because the sooner we can uh, get through this crisis, the better it's going to be for Asian Americans, in my in my opinion. Like when you're at home and your economy is a shambles, it's bad for everyone. But if we can get through this crisis together, then to me, if you can help in any way in that sense, so I feel like people should just be rallying around our healthcare providers. Certainly, if you have the opportunity to do so, and you can help get PPE into providers' hands or make a donation to a coronavirus relief fund. The more we can do for each other during this time, in my opinion, the better it will be for all of us, but also it will help reduce the hostility towards Asian Americans. That's something that we all can do. Just listen to the guidance we're getting.
Yeah, I mean, I think in any time of crisis, it's so easy to want to blame someone or blame something. I mean, listen, I fall victim to that as well, but we are all in this together. And if we could just channel that tension, that anxiety toward trying to help people recover from this and trying to support our healthcare workers. I
Yes.
mean,
Yes.
I can't stop thinking about how these men and women are waking up every day. They're leaving their families, and they're walking into the lion's den. And again, as I said earlier, so many of them are just not prepared to do so. And if in terms of the supplies, like they don't have enough PPE. And if we could
Yeah.
just channel that tension into something positive, again, I believe that there will be time for a reckoning after this.
Yeah,
I have
and that's
another
one thing I find
question.
really
Oh,
upsetting,
sorry.
Lisa, is that there's like a competitive dynamic between states in terms of getting PPE for hospitals, and like it's very upsetting because I have friends who are working in these hospitals and these medical offices, and a lot of times they're underprotected, like they don't have the resources, and it's still unclear how effective we're being at getting the masks and the gowns into people's hands where they need it. And so the logical thing to do then, if you're this hospital or this doctor, is just try and attend to it yourself. And so there's this really like every uh, facility, system, state for itself approach. And it's not helping any of us. It's one reason why I don't understand why Trump and the government have not nationalized some of these procurement protocols much earlier in the process, because like a free for all doesn't help any state, it doesn't help any hospital, it doesn't help any doctor or nurse or healthcare provider.
So, Andrew, thank you for that response. Sophie asks, how are you talking to your children about this? What suggestions do you have for parents? Andrew, have you talked much to your boys about COVID-19, and have also talked about its origins and what has been talking to Asian people who look like them?
My boys are quite young. They're only 7 and 4. And so we've told them about the coronavirus and the fact that we're not in school. You're not going to be in school for a while until the coronavirus. And you're not seeing your friends and you're not doing a lot of things because of the coronavirus. We haven't talked to them about the origin of the coronavirus. And I'm happy to say that because they've been out of school, in part, I'm sure, but they haven't had these kinds of conversations with their peers. And so that they haven't been themselves they haven't experienced any kind of virus-related racism or hostility directly, which I'm very happy to say. So those are the conversations we've had, but our boys are younger than many other people's children who I think you would need to have different kinds of conversations with. My kids are also extra oblivious, honestly. Like the older one is on the autism spectrum, so he's like like pretty unmindful of a lot of things that go on around. The other ones. So in this case, it's a blessing. But I'm just saying that my parenting experience might be a little bit unusual.
Yeah, I mean, this is really hard. I have a 7-year-old and a 3-year-old, and I've had conversations with both of them. They are aware that the reason why they are not in school is because there are a lot of people who are sick, and that they are sick because of this virus that is spreading very easily. I have not had too many conversations with them about the origins of the virus or the things that are happening. Because I'm nervous about having those conversations with them. About a year ago, my daughter here in our town where we live was at the market with my mom, and there was a man who, she was eating something and it spilled very close to his shoes, and he sort of screamed at my mom and my daughter. He said, Go back to China." This was more than a year ago. This was long before the coronavirus. But it upset her so much. I mean, she was hysterical. And so I do know that I need to have conversations with her because it's inevitable that she will hear about it herself. But these are really challenging conversations to talk about. And again, this is just a stressful period.
Anyway, for all of us, yeah.
This is yeah. I mean, this is entirely unprecedented. I have another question from Michelle. Racism has always been a huge part of our history in America and even around the world, and it seems like we have a hard time moving away from that, even going backwards. What can we do to change that? Is this something we need to start openly teaching in our education system?
I certainly agree that racism has been central to the story of America for really its entire history. And if there are ways that we can teach our children about racism in a way that helps minimize its corrosive impact on our lives, on our communities, then I would be all for it. Certainly, to me, America still has many things that it's struggling to reconcile. And as the child of immigrants myself, like I love this country. I believe in this country very deeply, but I also know that this country has a real legacy of racism that has impacted tens of millions of Americans in various ways. So our educational system certainly should be part of.
Andrew, you just froze. I don't know if that's a permanent freeze, but I'll contribute my 2 cents to that question. I absolutely think that teaching about racism should be part of school curriculum. During African American History Month, I know we spend a lot of time talking about Martin Luther King Jr., about Rosa Parks, and it's fantastic. And I think that it's given my daughter just such an understanding and appreciation for African American culture in this country and the struggles that African Americans have experienced in this country. During Asian History Month, it's more celebratory. We have a lion dance at school, but I think it's really important to also acknowledge that Asians have been the subjects of a lot of discrimination in this country as well.
Hey, all, I'm back. My iPhone hit an emergency overheat, so now I'm on a laptop. Look at this redundancy.
Well, Andrew, okay, I'm going to wrap this up soon, but I want to ask you about your piece in the Washington Post yesterday, which I thought was fantastic. It was titled, "We Asian Americans are not the virus, but we can be part of the cure." What do you mean by that? What do you think Asian Americans should take away from all of this?
It's a very, very tough time for all Americans. Asian Americans, I think, have an extra burden by the fact that now there's been an increase in racial animus and hostility. And so we have to take this as a real challenge and call to action and say, look, of course it's not us, like we are not the virus, but we have to do everything we can to help our country get through this time and demonstrate that we can be part of the solution. And so for me personally, I'm doing several things. Number one is my organization, Humanity Forward, has now raised $1.25 million for coronavirus relief. And we're just putting that money directly into the hands of Americans who are struggling, which frankly is millions of people at this point. So we don't have the resources to help everyone, but we're just giving money to the people that need it. And if you want to contribute to this effort, if you go to movehumanityforward.com, every single dollar will go directly in the hands of an American who's struggling right now. And then the second thing is we're launching a campaign in the next 1 to 2 weeks around rallying together and saying we're all Americans. We all need to get through this time, and we need to help get PPE and financial relief and resources to the communities that need it most. So those are a couple of things I'm working on, and I would urge other Asian Americans to take this as it is a crisis for all of us, but it's also a real challenge and opportunity for us to reframe and even forge a different understanding of what Asian Americans mean in this country. And that includes doing things that, frankly, we in some cases have been below average at, like voting, volunteering, donating to political campaigns and causes, donating to relief funds. Certainly, if you're proximate to the healthcare system and you can help directly in that way, then that would be phenomenal. 17% of medical doctors in this country are Asian American. So many of us are on the front lines already, but we have to do more, not less. We have to step up, and we have to show authoritatively that even though we had nothing to do with this virus, we're going to have a lot to do with getting our country through this time.
Yeah, there's no, there's no point in being complacent when we can be active and activated. Andrew Yang, thank you so much for your tireless efforts to improve the lives of all Americans. In closing, I just want to say, look, this crisis is just bringing out the best and the worst in people. And I really just hope that we can focus on getting through this and helping people who are sick and those who are on the front lines battling the virus. When it's all over, there will be time to figure out where the blame should lay, to recognize the mistakes that have been made. But now is not that time. We are all in this together.
Yeah, first thing and let's just take care of ourselves and our people.
Yeah, if you or someone you love ends up in the hospital, it could be an Asian doctor or an Asian nurse who is treating you. And I'm sure that he or she is going to fight just as hard for you as anyone would. So thank you so much for taking the time to be with us, and let's do this together.
Yes, thank you, Lisa. Be safe out there, everyone.
Put the money in our hands. Put the money in our hands. the money in our hands. Put the money in our hands. Can we afford it? Yes. Will it cause inflation? No. Is it awesome? Yes. Is anyone trying to make it happen?